Now to the rising cost of health care as Congress weighs letting ACA subsidies expire, leaving millions scrambling to pay for skyrocketing premiums. One Texas woman decided to marry her partner so she could join his employer insurance plan. Mila Clarke made the decision after her premium reached $850 a month to treat her type 1 diabetes. Now, she's telling her story. Mila, thank you for joining me. You're a diabetes patient advocate. How dire was this decision for you to get the coverage you need?
This decision, Ike, is life or death. It is something that I am not able to have a choice in. My body doesn't produce insulin living with type 1 diabetes. And if I don't take insulin, I can die. I think something that is really important to know also is that the cost of diabetes is exorbitant. It is so expensive to take care of this illness. And having access to healthcare is the key to being able to manage and live a happy and healthy life overall.
Absolutely. Now, you're also a small business owner. How would losing those subsidies affect that?
That was a really scary time for me because it created a gap where I didn't know if I would have coverage to be able to afford my insulin, my continuous glucose monitor, and the supplies that it takes for me to keep myself alive every day. And really, I'm so happy to be married to my partner. We love each other. Obviously we made this decision out of love for each other, but it wasn't what we wanted. We really didn't want to involve the government in our relationship. We were happy the way that we were, but when we looked at the costs versus what it would take for me to be able to have access, it was the only decision that we could make.
So what's your message to Congress before these subsidies expire?
Truly, it's to just remember the millions of Americans who need access to healthcare. We all, every single one of us, whether we have diabetes or we're living with another condition, deserve to be able to not have fear around whether or not we'll have the life-saving medications that we need, or that we'll have to be bankrupted by going to the doctor or going through emergency care. And so I really hope that Congress looks at the impact of what these subsidies have done in terms of access for Americans and really considers making sure that they have the staying power they need so that we all get the healthcare that we deserve.
At first I want to say congratulations to getting married. However, it is striking the fact that it came to this just so you can get your healthcare benefits. So talk to me about the politicization of healthcare right now. Whether you're Democrat or Republican, this is affecting every American. What's your take on the politicization on this issue?
Absolutely. We know that healthcare is political. Our health, our well-being, our access, even when it comes down to what foods we eat, when it comes down to what we are able to do to take care of ourselves. And so, I think a lot of people will say this is a political issue or it's not a political issue and we shouldn't talk about it in those terms. But when you look at stories like mine, where people have to make these extremely impactful decisions about their lives because they're not sure about what happens to their care because Congress has it in their hands, I think it's something that we all should raise the flag on, that we all should be looking at, and that we should be really diligent about telling our leaders that we want and that we need.
All right, Mila Clarke, thank you for your time.